My name is Dr. Ryan Palmer, and I am a hip and knee replacement specialist here at OrthoNeuro. I always knew that I was interested in a career in medicine because medicine is one of the fields that allows you to have autonomy, but also to allow you to be in a field of science. And you know, my path into orthopedic surgery was really a stepwise process. And the interest that I grew for orthopedics really stemmed from many different rotations where I was able to see orthopedics in many different ways. And the tangible nature of orthopedics and eventually hip and knee reconstruction is really what drove me into the field and into the subspecialty. My education started at Miami University in Oxford, Ohio for undergraduate studies. And then I went to Ohio University Heritage College of Osteopathic Medicine for medical school. From there, I went to orthopedic surgery residency here in Columbus, Ohio, through the Ohio Health Network, working through Doctors Hospital, Grant Medical Center, and Nationwide Children's Hospital. From there, I did a fellowship in hip and knee reconstruction at Baylor College of Medicine in Houston, Texas. My passion surrounding hip and knee replacement surgery really stems from the tangible nature of the subspecialty. I derive a lot of satisfaction from being able to take people from pain and dysfunction and restoring that joint, restoring the joint mechanics that then allows them an increase in quality of life and potentially getting them back into activities that they once thought they may never do again. What I believe makes OrthoNeuro unique is that we are a private group practice, and one of my passions in getting into medicine was to be able to have the autonomy to make decisions and also to be a part of a group that allows the physicians and surgeons to make decisions based on what's best for patients. And I think that healthcare is such a dynamic field that there are always going to be changes, and I do believe that by being a physician-run group that we are going to be able to adapt to those changes in the best way. And that's going to be seen on the patient's end from patient outcomes, new surgical approaches, technology incorporated in diagnosing and treating patients. And that certainly makes us unique here in Central Ohio.